All right, today we are going to be doing our IV maintenance checkoff. I want to start with our 12 safety practices. We are going to verify the care and order for the patient. We're going to remember to wash our hands before and after touching a patient or any supplies. We're going to review any policies and procedures at the facility we're working, and we're going to gather the appropriate supplies and assemble it. We're going to remember to consult manufacturer recommendations regarding the use of their supplies. Then we're going to knock on the patient's door, enter and introduce ourselves, identify the patient using 2 patient identifiers such as name and date of birth. After this, we will note the overall condition of the patient. We're going to explain the procedure to the patient and provide the patient with privacy. We're going to raise the patient's bed up to a level for good body mechanics, and we're going to apply any PPE that is indicated for the patient or the skill. Upon finishing the skill, we're going to lower the bed to low position, apply side rails as indicated in the care plan, and place the call light into reach. And we're going to note and report any abnormalities that the patient had to the charge nurse or primary nurse immediately. I'd also like to go ahead and state my 7 rights of medication administration since we're going to be hanging fluids. You're going to do right drug, right dose, right route, right time, right patient, right indication, and right documentation. I'm going to start with assessing the IV site and removing the IV. I'm going to go ahead and I'm going to get my gloves on. I can get them on. Now when we get at bedside, or before we get at bedside, we're going to also want to review the patient's orders and verify the order for the fluids and the flow rate. We're going to come in, we're going to assess the IV site while it has fluids going. We note that the fluids are going, so the IV is patent. We're going to note for any redness or swelling, phlebitis, infiltration, any abnormalities like that. To remove the IV, we are going to remember that we're going to have to disconnect the patient from their fluids, terminate the flow. After we do this, I would explain exactly how the procedure is going to go to the patient to reduce any anxiety for the procedure. I have my sponge here and my little IV catheter. What we're going to do is we have our gauze ready. We're going to remove the tegaderm using light traction so as not to hurt the patient's skin. Okay. You're going to take your gauze, fold it over, and you're going to apply pressure down here at the base of the site. And with a straight line with the vein, you're going to remove the catheter, like so. And the IV catheter, you're going to want to assess it to make sure there's no shearing, to make sure it's intact and it's all one piece. And you're going to dispose of it per the facility policy. You're going to hold pressure to the site for 2 to 3 minutes. If they're on anticoagulants, for 5 to 10 minutes, you'll hold pressure or apply dressing. You could always take tape and tape down the IV site. I couldn't find any tape, but you could do that as well. And you're also going to want to document everything with the assessment of the IV site that we did earlier, and you're going to want to document how the patient tolerated the procedure. And that is removing the IV. All right, the next thing that we're going to do is I'm going to show how we would initiate IV fluids and do drops per minute. We have our normal saline here and our IV tubing. You're going to verify the order for the normal saline and the rate that we want it to be going. In this case, we're doing 60 drops per minute. You're going to remember to do your hand hygiene and put your gloves on and all that good stuff. Order's been verified. Let's see, we're going to open up our IV tubing here, if we can, anyway. Okay. Come on now. All right, so we have our tubing set here. Go ahead and get this off. All right, we have our spike here with our chamber, and we have the end that's going to hook into the patient. You got your ports on here for any piggybacks or anything that might need to be hung. We have our fluids clamped off right here. And whenever it's all the way down, your roller clamp, the fluids are stopped. So we're gonna go ahead and roll that all the way down. We're going to remember that whenever we're hanging these fluids, we can go ahead and take this off, but we don't need to touch it because this will hook into the patient's IV site. You're gonna wanna hold it upside down so you don't get fluids everywhere. Your spike here, you can take this off, and don't touch that either because it's going into the bag. We don't wanna contaminate anything. We can pull that off. We're gonna spike the bag. All right, we're gonna squeeze the chamber, get some fluids in there. All right. The next thing that we're going to do is unclamp here. So, if I can get it. We're gonna do our roller clamp. You'll see the fluid starting to come out. We're doing this just to prime the line. You're going to want to make sure that the fluids go through the entire line. I'm going to go ahead and go over here and hang it. All right, we have some fluids coming out, so the line is completely primed. The next thing that we're gonna do is we're gonna count for a minute while rolling the clamp and try to get to 60 a minute. 60 drops a minute. So we're gonna watch it drop. Okay, a little faster. Four. I'm gonna go ahead and have cameraman come around, and we're going to video up close the drops for a minute so you can see that they are at 60 a minute. 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 7, 28, 29, 30, 31, 2, 33, 34, 8, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 54, 55, 56, 57, 8, 59, and it's been a minute at 60. Alrighty, go ahead and clamp this off, and that completes our IV maintenance checkoff.